welcome to our next episode of She Belongs. I'm more than happy to introduce you to Heather Aliotta and thank her for joining us in this episode. She is a nurse practitioner and clinical education coordinator at Brown University Health Services. She earned her Bachelor of Arts from Brown University and Master of Science in Nursing from Massachusetts General Hospital Institute for Health Professions. She focuses on women and adult health and currently works as a nurse practitioner at Brown University Health Services and previously worked in the emergency room at Women and Infants Hospital at Rhode Island. We are very excited to have Heather as our guest and talk about gender-based violence on college campuses and especially during the COVID-19 pandemic. Heather, hi, we're very thrilled to have you in our podcast. I would like to start our conversation with my first question. So you have been working as a nurse practitioner at health services and also worked previously at Women and Infants Hospital. So what do you think are the reasons behind gender-based violence and sexual violence showing an increasing trend in college campuses and work environments?
Thank you so much for having me as your guest. I have worked in those two settings. They're pretty different. At Women and Infants, we took care of women and patients who identified as female for a variety of reasons. We screened all of our patients as they were coming in for safety, and we also performed sexual assault exams. I was a sexual assault nurse examiner, and we also took care of pregnant patients and patients who had other chief complaints. Then about 4 to 5 years ago, I came over to Brown to work in the student health services and a little bit more of a primary care / urgent care model. And I take care of male patients, female patients, non-binary, and transgender patients. And again, we screen patients for safety in their relationships and see them for, various reasons. So in terms of what I've seen over, the last 17 years or so in my practice here in the state of Rhode Island, it is definitely upsetting to see the trends. I'm also a mom. I have a daughter in college and two more, one at elementary level and one at high school. And, I want the world to be a safer place for everyone. But in particular, personally and professionally, this is an issue close to my heart. With the recent COVID-19 pandemic, more people are feeling isolated, less people are at their jobs, in their classrooms. People are losing jobs, they're losing, there's food insecurity, housing insecurity. And for me, it's always seemed like perpetrators were potentially acting out of control, anger, frustration, potentially, repeating cycles of violence that they witnessed as young people, children, that sort of thing. But I haven't really studied that population more. I've taken care of survivors and tried to meet them where they are and support them and give them acute care, but also provide primary care over the years with an acknowledgement that, they may have been through some trauma and helping them to feel comfortable with routine exams as well as GYN exams. In the hospital setting, we took care of patients who are miscarrying or had complications with their pregnancy. And that's a time where the patient can feel a little bit out of control themselves. And if they've felt vulnerable or out of control previously in other relationships, it can be a real scary time for them.
Yeah, definitely. Thank you so much. This is definitely really informative. Extending on what you said, what are some of the barriers that are standing in the way of preventing or reducing gender-based violence cases in college campuses, or let's say work environments, especially when reaching out to victims or prevent these types of abuses?
In so many circumstances, there aren't any obvious signs. You can be talking to a person and have no idea what their home life is like or their romantic relationship is like. With such ready access through social media and cell phones, gender-based violence can happen in person with another individual but the stalking, the harassment, all that sort of thing that can sort of lay the groundwork for things to get even worse, is also a concern to me. I think probably people are afraid to come forward. They may have, had some piece of them that, felt like they did something wrong, or they should have known better, or why did this happen to me? Self-blaming. But I tell all of my patients in the emergency room, as well as in my current setting, this is not your fault. You didn't do anything to have this happen to you. This other person did this to you. And to try to support them wherever they are in their journey. And sometimes we don't have a lot of time in a visit, when we have to build rapport over time for someone to finally disclose to me what's happened to them, or have them ask me questions. But it's the sort of thing where if you listen and you give a patient space, they will tell you, and you will be able to hopefully help them find resources, whether on the college campus, which we're really lucky at Brown. We've got a number of different resources, which we'll talk about a little bit later, or in the community. This year, with so much of our interaction being online like this, I've not seen all of my patients in person, and that can be challenging, but at the same time, the support that can be provided to them also can be on telehealth or through Zoom or whatnot. And so patients don't have to go to a special building, or take time out of their day to navigate a part of the city they're not familiar with necessarily. And hopefully those resources can become more readily accessed over time.
Heather, thank you so much. So as you also mentioned, I would like to extend a little bit more on like help and support. So in order to reduce this number of gender-based violence cases and sexual violence, what can be done in a college environment in both a first responders perspective and also as an outsider, family or friend, to support the victim to such a violence? What do you think?
Well, first, I think it's important for us to realize this can happen to anyone, regardless of your racial identity, your ethnic identity, your socioeconomic status, your gender. Anyone can potentially be a person that has this experience. And we all heal differently from experiences. So there are some students who are going to want to go right to Title IX, right to disciplinary action, maybe even to the police. There's other people who just want to know, do I need medical attention? Is anyone going to be able to tell that I had this experience? So really listening to the person and being open and not judging them and not blaming them is really important. In terms of outreach, I think we do, a great job through Be Well and the Share Advocates at Brown. Other college campuses have similar type of outreach, but I'm really impressed with what Brown provides. And, we have different ways we get the message out via social media, our website, the Be Well website, Residential Life, that sort of thing. Back in the day when, people were going to the dining hall and eating at tables, there was table slipping and posters. And there are a lot of different outreaches that happen during orientation for first year students and transfer students. And some of the Greek organizations and the teams have had other types of outreach. In the past, when we were in person, I was part of a panel with Be Well for learning about safer sex and that sort of thing. But even in the confines of a conversation about STI testing or safer sex, you can still let people know about resources if they've had a non-consensual encounter, or that there are certainly questions that lead to more questions, and to just try and be open and know that the conversation is going to continue even if this visit ends.
Thank you so much. These are definitely incredible resources. So I would like to extend a little bit on this. What are like some type of other resources in general, like statewide or like um, nationwide? And then do you think they're enough, or like what can be done to increase their effectiveness? Because not all people know that they're even available. So how can we let people know the availability of these resources, because they're actually incredible resources that everyone should be made aware of?
Absolutely. So when I was at the hospital, we struggled with how to get the word out that we had these special sexual assault nurse examiners and that sort of thing. So the hospital, made outreach towards the different ambulance companies because sometimes people come in through rescue, and a variety of other ways. Let the other hospitals know, let the providers in the community know we offered these services. We had little cards made up, and where do we put these cards with this phone number in the bathroom or in the exam rooms? Where can we let people know there is help in a way that won't come back and cause them more harm? Because sometimes, particularly in a domestic violence situation, the perpetrator, if they find out the person's trying to get help, things can escalate and be worse for her usually. um, in Rhode Island, we're really lucky. There's the Day One Sexual Assault and Trauma Resource Center. They have a victims of crime helpline 24/7. You can talk to someone specifically in the Rhode Island area. There's also some nationwide hotlines and websites that we're going to share a little bit later on. The National Sexual Assault Hotline. There's a special helpline for male survivors, domestic violence hotline, the suicide hotlines. Those are all super important. At Brown, as I said, we have the Be Well department. We have the Share Advocates, CAPS, Brown University Health Services, DPS, REMS, are all really well versed in what victims and survivors might need in terms of their support. And then furthermore, in the city of Providence, the police departments and various other social services agencies are available.
Yeah, definitely. Thank you so much for mentioning these. These are definitely really important resources for the survivors and also for the families or like friends of the survivors. So definitely, thank you so much for mentioning. So I would like to mention a little bit about the stigma that is being faced. So there seems to be a stigma that is present towards gender-based violence, not only on college campuses, but also in general. What can be done to eliminate this and to be able to talk more about the issue or like raise awareness and overcome the stigma? Do you think this is also an issue in college campuses or like in work environments?
Sure. When I was an undergraduate at Brown about 30 years ago, there was a list that was started in the Rockefeller Library bathroom of names of perpetrators because victims at that time didn't feel like they had a way to help each other. And they didn't want other people to be, in the situation they were. I think we've come really far from that moment in time. Um, and Brown is a very active campus. Even this semester, we just finished with so much happening online and very little happening in person or hybrid. But the university administration and Be Well and health services and Res Life, the goal is for our university to have as much opportunity for people to seek advocacy and support and healthcare and potentially adjudication of certain circumstances. But again, you really need to be aware that the person you've known for 5 minutes or the person you've known for 5 months could have had an experience and they haven't disclosed to you. So making judgments about other people's home life, experiences in high school before they got to college, or if you're a graduate student, your friends' experience at their undergraduate level before they knew you, it's really important to be sensitive and keep the dialogue open. And not everyone's going to feel the same way. Not everyone's going to pursue the same thing. I certainly had a number of patients who came in through the ER who wouldn't choose to do the forensic exam and just wanted to get checked for STIs and medicated for STIs and that sort of thing. And that, is hard, but it's her choice. It's not my choice. It's her choice. And listening to that and being present for that and allowing space for someone to process what's gone on for them is really important. Whether you're their friend, your healthcare provider, their professor, their mentor, whatnot.
Definitely, especially knowing like how far we have come from like years ago is very interesting and also very impressive. And yeah, but unfortunately, we're facing a pandemic, and because of this, everything is changing. Even like the type of resources, we are reaching more towards online resources and so on. So we have talked about the resources, help, and support that is like available for gender-based violence victims and also their relatives or their families. So during the pandemic, as we may also know, a majority of these resources have been online, unfortunately. But do you think these limited in person and generally online help has been affecting the overall situation compared to the pre pandemic situation? Or is it also like creating some positive outcomes too?
So early on in the pandemic, everyone started talking about social distancing. And that was really frustrating for me and continues to be because we need physical distancing, but social connection. So whether it's someone who's struggling with symptoms that might be coronavirus infection or a rash or the aftermath of sexual violence, those people need to not be in isolation. We need to connect with them, whether through telehealth or in person. We need to see our friends and family members through video. And then when it becomes safer for individuals in person. And I think the same holds true for this kind of service. The nice thing about being able to provide service through a computer screen is that, like I said a little bit earlier, it's on the person's own terms. They make the appointment, they are in their own safe space, hopefully. They can be without a mask. It's really hard to be judging someone's full experience if they're wearing a mask sometimes. Um, and, lastly, often the feelings of isolation can compound the stigma and the fear and the possible guilt that someone might feel. So if we can connect with someone, even just for a few minutes over a video, and then maybe they'll come in person next time, that's great. And, luckily at Health Services, we provide a variety of services, not just, related to violence. So when you come into our building, that's not the only reason why people come in. And a lot of the mental health professionals that I know who either work through CAPS or are off campus, they are for the most part seeing people through video, and they will say the same thing. Like, it's really freeing. People are, more on time to visits. They are more willing to make the appointments. You can actually see them without a mask, that sort of thing, as well as, the flexibility of being able to have more time without us doing commutes. So maybe you have a longer day, or you have more flexibility in the evenings or on the weekend, because you're not commuting into another place, for example. So it's not just the patient leaving their house, but also the provider potentially leaving their space.
Yeah, definitely. There are definitely a lot of positive outcomes of this online environment too. Like you said, masks, for example, because we cannot see someone else's like facial expression or what they're going through. And sometimes the mimics or the facial expressions are really important to assess a certain situation, as you may also know. So, how can we increase these resources and make them more accessible during this online environment, especially online help resources and support? And what should be done about this? And what are your opinions as someone who has been working closely with these types of patients and students in general as a nurse practitioner?
I think when we first started doing telehealth type visits, it was really surprising to me. I didn't like it. I felt really separated from my patient. We had some technical issues. For the most part, our internet coverage is pretty great in this part of the city, but there was some electrical issues or whatnot. But we've really weathered all of those bumps, I think, for the most part. We've come out on the other side and been able to see some of the benefits of providing telehealth or online resources. People have the option to turn their camera off if they want to. I like it better if it's on, so I can at least see them for a few minutes for their facial expressions, like you said, or their body language. But if they really feel like they need it to be off, that's okay. Occasionally I've had to do phone visits because the video component wasn't working or whatnot. I've had, people talk to me in their car out on the green while they are walking down the street, So your generation is much more facile with technology and, being connected to your phone and whatnot, and various apps and that sort of thing. And, being able to get help at 3 a.m. through a website or through texting help to one of the resource lists that we have. It's, pretty amazing in terms of that. I have to say that patients have been really receptive to, having different ways to have visits. And if you're not, physically in Providence, this is another way for us to connect. And that's really important. I really have, just tried to meet my patients where they are and their healing, as well as where they are in terms of their preference of coming in person versus seeing me on a computer screen.
Yeah, I agree. This online environment is definitely creating like a smaller world where the location does not matter anymore, but we can communicate no matter where we are, as long as we're safe. So that is definitely a valid point. And I also want to ask you, what was it that motivated you to devote your life to being a nurse and helping victims of violence or students in general?
Oh, wow. If you asked my mom, she'd probably say, I was always trying to take care of everyone. So I went to Brown many years ago, as we discussed. I took full advantage of the open curriculum. I always know I wanted to be a healthcare provider. I just was fascinated by helping people and science and that sort of thing. But I also took some art history classes and comparative religion classes. So when I graduated, I didn't have physics and chemistry to then apply to graduate school. So I worked and paid back my student loans and went to school at night and volunteered on the weekend at a women's health clinic and met a nurse practitioner who, explained to me that, this was an option for me. Back then, there weren't very many nurse practitioners. And actually the MGH Institute of Health Professions was only one of 2 programs really in the country that I could apply to. So luckily I applied there and I got to stay in Boston. And I just always knew that germs or the medical model of, that linear relationship between germs and illness, as it were. I'm simplifying a lot. Just didn't really resonate completely with me. I was always interested in, the whole patient and why it was that they got sick and what we could do to help them, and not just have them live free of disease, but have a life experience where they were, in the pursuit of wellness. Wellness is an action state, not a steady state. And I, was drawn to women. I'm a women's health and adult nurse practitioner. I like taking care of all my patients, don't get me wrong. But I really was drawn to people who are vulnerable, people who are on the edge, people who, are not as well represented in the scientific studies, unfortunately, that sort of thing. And just, the amazing role that education can play and helping someone understand their health status and how to improve that. And that's why for me, college health makes a lot of sense, because I have 17-year-old first-year students all the way to 53-year-old graduate students at this wonderful university. And I see some people over time. I see some people only one visit for, getting those sutures out from some accident they had. But it's a really great place to be and to help people affect change in their life. And, we just finished up a semester, and, a lot of people came in towards the end of the semester to get everything done before the end of the semester. And it was really busy. But that's great. I love that. I love that you can't predict each day and, what's going to happen. And none of us could have predicted the pandemic. That's put a whole nother lens on the work that we do. But it just reminds me how important it is to, keep showing up either online or in person and, helping my patients on their journey.
Thank you so much, Heather. This is actually amazing. And it was very, very such a pleasure to speaking with you today. And also for our audience, I want to say that we will be attaching the resources sheet in the description, and also um, it will be on Spotify or like wherever you're watching this or listening to this. And thank you, Heather, thank you so much for taking the time to talk to us today on our podcast. I really, really enjoyed our conversation, and I'm sure our listeners will learn a lot from this episode. Thank you.
Thank you.